All right, so I'd like to hand over to our first presenter. Today we have three presenters, Dr. Fawaad Iqbal, Dr. Cheryl Peters, and Brandon Purcell. So firstly, I'll hand over to Dr. Iqbal to give a introduction and begin his presentation.
Right, thank you, Tina, and thank you everybody for joining. So I'm coming to you from Ontario, and if you can go to my first slide, perhaps, then I don't know how many people are from Ontario on this, but I think my front page kind of sets the tone of what's going on in Ontario. So this is on behalf of myself and our regional screening program, so particularly Shannon Bork, who did a tremendous amount of work leading this locally and kind of within the region. And next slide, please. And similarly, in terms of acknowledging the land and the history of where we are not a huge region, but we have quite a bit of spread over where we were or are in Durham, Northumberland, Peterborough, and Quinte. So particularly for me and where I live, it's where the Anishinaabe kind of territory was, so it's an acknowledgement to them. Next slide, please. And this is where we are. So the Durham Regional Cancer Program covers the Central East region of Ontario. On the left picture there, just to the left of us is Toronto. So we catch the very east edge of Toronto out to about halfway across Lake Ontario. And it's about just over 1.5 million people kind of within our region. And we're a relatively quickly growing region within Ontario because people can't afford to be in Toronto. Next slide, please. And so Ontario does have pretty good data about kind of what's happening within certain regions. There continues to be reformatting of some of the borders of these regions, but it's reasonably accurate data, and I highlighted a couple of them here just as a bit of a background for kind of our program. You probably can't read it, but the left slide is emergency room visits related to alcohol. Peterborough's in the top 7 there. We're like most of Northern Ontario kind of is worse off, but our region is pretty consistently up there. And on the right side, it's kind of current levels of alcohol intake. And similarly, we're right up there. We've got top 6 for some of our regions within kind of our catchment. So it's a known thing for us that alcohol intake and kind of alcohol consumption is an issue for our region. And certainly within the province of Ontario, it's on the radar of the government, not in the way that we would like. Next slide. So I'm going to go back and give credit to BC, and they're up next. So I'll give them some credit right now too. Back in 2020, there was the Now You Know campaign. I think it was Fraser Health, and they had done this as a public health campaign. Several posters and ads were kind of run. You can kind of see them there, essentially explaining that people didn't really know that alcohol could cause cancer. Next slide. Fast forward a little bit, and I'm pretty sure everybody on this call is aware that by end of 22 and then just into 2023, the recommendations for alcohol intake were substantially reduced. So the final guidance, kind of the final publication came out, and there was a wave of kind of media that went with it. And so as our program, we were trying to kind of ride that media wave and say, okay, look, this is a good time to get some acknowledgement, some education kind of out into the community. So what can we do? Next slide. So that really was the purpose, was kind of education, not like It wasn't about kind of influencing policy. That's not really what this program is capable of doing. So it's within our region. It was how could we increase awareness in the public. Um, as everybody knows, like the amount of information and commercials and just alcohol industry spending is not something we can compete with. And even within our budget locally, there's very little money available for prevention and screening. So it's kind of ticked off as no money. Next slide. So we kind of checked on a lot of different things as to what we could do. The next few slides kind of go through some of these options. So billboards, for example, a billboard near Highway 401, which is one of the biggest highways in the country. For a month, it would cost you about $2,000. There's no real way to know what that's doing. And it was just pricey. Next slide. Radio advertising was even way more expensive than we thought. So for a period of a month to be over $20,000 is just not something we can do here. Similarly, how would you actually know that people didn't just change the station anyways? Next slide. Print advertising perhaps shows the age of some of us who are working on this. I think the target audience may read newspapers, but probably not. And similarly, just the price was not something we could afford. Next slide. So that leads to everybody's current favorite things. So Instagram and Facebook and everything social media, which really essentially came down to be our only option, because we could afford it. Like that really was the practicality. Like they could scale the budget, depending on how many ads you put or how frequently you want it to pop up. They could scale the budget to basically be within our budget. Next slide. So we modeled after the BC program and came up with some kind of ads, informational graphics, really to be published on social media. So the next few slides are those. So, correlating alcohol risk with cigarette risk. Next slide. This one was similar to a BC slide that, alcohol doesn't have a warning label, but it probably should. For the record, that's kind of my personal thing on this, is that we really should have a warning label on it. So I kind of pushed that one personally. And then each of the slides, or so each of the infographics also had a link to our cancer website as well. Next slide. Or sorry, not cancer website, the Central East Cancer Center website. Here's just another example, cigarettes and alcohol, both of them can cause cancer. Next slide. And then another one. So this is a little more specific about what kind of cancers can be caused. The common ones being breast cancer, colon cancer. Next slide. I think this is the last one. So just once again, the social side of alcohol and, kind of the motivation people have, but yes, you can get cancer. Next slide. So the total cost for this to run for just under 2 months was just under $1,000. I don't exactly understand what reach and results are. We never really got a straight answer from the company about this, but reach, as best as we can tell, meant views. So how many people actually ran across this, and then results were some kind of interaction. So whether it was a thumbs up or a share or something. So cost per result was about $2 for somebody to actually interact in some way. Next slide. Just by distribution, it actually was reasonably well distributed across groups. And for me personally, I was a little surprised to see it kind of stacking towards the older age groups, but you'll see why in just a second, because we weren't on TikTok, we were on Facebook. So the 40+ crowd is probably on Facebook, whereas the 20-year-olds probably are not on Facebook. Next page, next slide, please. So here it is. It was Facebook and Instagram. This was kind of a test project for us too, so that was kind of where we started. And I think for what we tried to do, I think it did work out reasonably well. Next slide. So you probably can't read it, but at the very bottom is kind of each of the infographics and then kind of what it ended up costing and what kind of results it got. It was pretty even across the board. Each one kind of cost $200. Each one got around about the same views, the same interactions. It has likes, it has thumbs ups, it has shares, it has stuff like that that would go along with any kind of social media post. But yeah, I would say in terms of kind of interaction and kind of feedback from the public to us, it is pretty one way. Like this wasn't something that was going to get a whole lot of traction, like, I don't know, in the news or something. Next slide is not the end, but I wanted to go to kind of the part of the topic of this just for the last couple minutes that I have about what kind of impacts did we have as our little program. And so a few good things that, there was some reaction on social media. So shares and thumbs up and, the shocked face emoji, like things like that. Like it was getting some impact on people. Further than that, in 2023, like later on, the chief medical officer of health actually used us as an example as what could be done, to help educate the population of Ontario. So that was actually kind of nice for us to get that feedback from high-level government.
Great, thank you, Tina. Very happy to be here today. Thank you for the invitation. So my name is Cheryl Peters. I'm a senior scientist in cancer prevention at BC Cancer, as well as at the BC Centre for Disease Control, and I'm also a partner assistant professor at the University of British Columbia School of Population and Public Health. I am going to speak today on a campaign that we did last year called The Proof. Some of you might be aware of it. I do just also want to acknowledge the very, very generous contributions of my colleague Javis Louie, who I work with in the BC Cancer portion of my job. He's kind of made most of these slides, so I'll probably just share any questions we get today with him. Tina, I'm not seeing the option to advance my slides. Are you going to do them for me, or? Oh, yeah, now I see I can do it. Okay, perfect. I just want to acknowledge where I'm joining you from today. I'm in Vancouver, which is away from my home actually, but I'm in Vancouver today on the traditional, ancestral, and unceded territories of the Musqueam, the Squamish, and the Tsleil-Waututh First Nations. So I'll just go through a little bit of background, just how we kind of got here. For those of you who don't know, I'm sure many of you do, BC Cancer is an organization underneath the Provincial Health Services Authority, and we provide a comprehensive cancer control program for the people of BC. Oh, I'm sorry, can people not hear me? Yeah, okay, other people can. Okay. So we do a lot of work on primary cancer prevention and highlighting cancer risk factors, including alcohol. So we did hear a question earlier about some polls, and I think there's many that are a little bit different. The Canadian Cancer Society reports that over 40% are not aware that alcohol consumption increases the risk of cancer. And I think there might be some folks on the line actually who've done more of that sort of cancer specific polling. On my team, we've done a little bit of polling, and so I will be able to share that. And we're about to do another national survey that's actually looking at cancer misinformation or cancer myths in general, but we definitely include some questions about alcohol to get a sense of how many people are aware of the link between alcohol and cancer. So in a grant that I held with partners from the Canadian Cancer Society and other folks in Canada in the research space around cancer misinformation, we did do a pilot survey funded by SSHRC. I guess it was probably 1.5 to 2 years ago now. We asked about a number of different things that may increase or decrease the risk of cancer, and we did include some information about alcohol in sort of both of those framings. So in this one, I'm showing you the graphic of to what extent do you agree the following can increase cancer risk. So you see here sort of the big ones that we might expect, where we've done a lot of public health messaging about smoking, exposure to secondhand smoke, getting a sunburn, these things, all people have quite good awareness of, kind of around 80% or higher. But when we see alcohol here in this survey, it was only around half of people. So kind of concerning. Our demographic for this survey, it wasn't sort of population based, but so it skewed a little bit younger because we use an online platform to do it. But so maybe younger people are doing a little better than that 40%, but not much. And there's a lot of people in our survey here too that disagree or strongly disagree that alcohol can increase the risk of cancer. And then on the flip side, we did ask people about what can reduce their risk of cancer. So again, you'll see these things like not smoking, practicing sun safety, not being exposed to hazardous substances at work. People had very good awareness of these things. We did ask about this framing here with red wine, and there's a bit of a halo effect that many of you are probably aware of with red wine. So that's why we asked about it. And we do see that there are a lot of people who either agree that drinking red wine can reduce your risk of cancer, or they just don't know. So this is kind of alarming to sort of see more than half of people either think red wine is fine or they don't really know. And the people that sort of strongly disagreed, it kind of mirrors that people who know that alcohol causes cancer. So pretty interesting things there, depending on how you frame that question. So the discourse when Canada's guidance on alcohol and health came out in early 2023, the discourse was a little bit, I mean, some of it was okay. So this one's sort of talking about sparking debate. That's no problem. There's some things calling it drastic, for example. There's some information about cancer warning labels, which came up in my colleague's presentation before. And then there's also a lot of things that are quite critical of that guidance, calling them unsupported puritanical killjoys, these kinds of things. So at BC Cancer, we decided we should maybe weigh into this because there's the link between alcohol and cancer is undisputed and it's very long standing. The International Agency for Research on Cancer declared alcohol a carcinogen in the late 1980s. So none of this is actually new. And so it's a little bit interesting that this was the backlash. Not that all of these headlines are backlash, but the ones that were much more backlash were really intriguing to us, sort of in a public health promotion point of view. So not that long after the new guidance launched, we decided to do a public health campaign in partnership with BC's Ministry of Health. We decided to target adults aged 25 to 49, and our goals of this campaign were to increase awareness of the link between alcohol and cancer, to provide tools to help audiences better understand their alcohol intake and what that might correspond to in terms of their cancer risk, and to just increase awareness of the guidance itself and the data behind it. So the campaign, I'll take you through a few slides about this. So we called it the proof. Which was a little bit of a play on words, right? So, the proof of alcohol, meaning the percentage of alcohol in a beverage. And we kind of turned it a little bit on its head here to use some more of the sort of beautiful imagery that the alcohol industry does when they advertise things. So, we put kind of classic or recognizable types of bottles or cans in there, but then sort of put this label on them that about cancer. We also shared a lot of information from the COMPARE study, so the population attributable risk study out of Calgary, where I used to be, which estimates the proportion of cancers that are caused by different types of exposures, and alcohol is one of the things that they covered. So these are sort of what some of the ads looked like. A few more here, so a red wine one and another kind of liquor bottle, like a Bailey's or something like that. So we chose a number of different designs. And then you'll see here, there's also QR codes on all of these posters that we have, which takes people to a website, which I will share in a minute as well. That website is still active and people can still use it now. We had these ads all over the place. So you might have seen some of them when they were around last year. So many of them in transit points, so places where lots of people are going to be gathered. We had them on bus shelters, in sort of the major city centers, but also in some smaller regions of BC. We also had a pretty engaged digital and social media advertising campaign. So you might have seen this if you are on Instagram. Our BC Cancer Instagram is very active, and we sort of shared a lot of our social media in this way. We did a lot of translations as well. So we wanted to make sure that the campaign was accessible across all the different language backgrounds that British Columbians might have. And so in certain areas of the province, we did share things that were translated into various languages that are spoken by a large number of British Columbians. Another interesting thing that we did this time was an influencer campaign. So we partnered with a few BC-based, I think they were all Vancouver-based influencers on social media to get them to promote our message. We've kind of learned a lot about how, maybe it's a little bit, maybe it can feel like you're getting lectured a little bit if the government or BC Cancer is telling you these things about cancer. But if you are hearing that message from somebody that you already know and trust and who comes across your Instagram feed every day, then maybe you'll be more likely to hear the message. So we partnered with 3 influencers who were doing either sort of fitness kind of content or foodie content. So one of our foodie influencers actually decided to go and make some recommendation lists for places in Vancouver where you can get mocktails. So they'd had like kind of really nice programs for non-alcoholic beverages. And so she would go around and sort of promote those restaurants at the same time that she was promoting the proof campaign and driving people to our website. So we really actually enjoyed these partnerships and have used the idea of influencers in other campaigns that we've done at BC Cancer. We also had a big media outreach with our communications colleagues at PHSA who really helped to promote some of the work we were doing. And so I did a lot of media. I was on the radio and on TV quite a bit in that campaign, sort of sharing what we were doing. So yeah, there was sort of multi-pronged approach to our campaign. We also had a number of resources on the website. So there's a campaign toolkit that people are welcome to take a look at. We had a drink calculator because we knew from previous research that people don't really know what a standard drink size is. So sort of helping people to understand that a tall boy is not the same as a regular can of beer. For example, it actually has almost 1.5 drinks. It's not just one drink. So kind of raising awareness about this aspect as well. So this is the website that I've alluded to. So it works on mobile as well as on people's computers, and it goes through all the sort of research. It really points towards Canada's guidance on alcohol and health. It has that drinks calculator. There's sort of some quizzes that people can go through to sort of see where their risk level is. And we did find that there was quite a lot of engagement on that website. Here's the part where you can look at sort of different types of alcohol in terms of sizes and things like this. So like letting people, well, maybe you only think you're drinking 4 drinks a week, but maybe it's actually 8 because here's actually the standard calculators. So yeah, we found it was quite interesting that people, we could tell with their IP addresses that many people did these quizzes over and over again. I think probably to see like, well, what if I changed to this? What would my risk be? So that's really kind of interesting that people used our calculator in this way. We also did share kind of in line with that influencer who was looking at zero proof cocktails or mocktails. We actually shared a bunch of recipes from her and other places that people could use to have sort of season specific cocktails, if you will. And so we were trying to share things from a more of a harm reduction approach. We didn't want to be preachy. We're not saying never drink alcohol. We're saying just be more mindful about it. Here's some other alternatives that can get your number of drinks per week just a little bit lower, because that will always be beneficial. We did do an evaluation campaign, as difficult as that is to do on some of these campaigns. So I will share a little bit of information about that. So this is just kind of during the actual campaign. I don't know what the numbers are today. I would guess not as much, but probably there are some people who keep going back. We did have 17,000 responses to that risk calculator that I just shared about. We did survey people. So about half reported knowledge of alcohol and cancer link had improved after seeing this campaign. There was also an in-person survey. So the company that we worked with to design this campaign did some sort of person on the street interviews in SkyTrain stations or, next to a bus shelter that had one of our ads on it and spoke to folks about it and asked them some questions. And we did see in that survey that 67% reported that understanding they are at a higher risk category for alcohol might encourage them to drink less. So, only 150 people that we spoke to, so maybe not kind of getting the full reach or the full understanding of intention to change behavior, but still sort of some positive signs that the campaign had its intended effect. I did want to talk a little bit about some of the comments that we got. So we had several different trends of people responding to our social media advertising. So the first trend here, I'm just sharing a snippet of this general theme. So people challenging the facts that were shared, accusing us of manipulating statistics. There's a lot of this sort of like, well, what about other things that cause cancer? Just misunderstanding of the science that we're sharing. Another trend that we saw was redirecting the focus to other causes of cancer. So that kind of came up in the last one as well, but these ones sort of saying like, oh, well, who cares about alcohol because way more people have bad diets, or what about, a whole list of things here in this second comment that's kind of interesting. Many of those things do not cause cancer. So that's also interesting too, this sort of like misunderstanding, which is a huge research interest of mine. That's why I kind of mentioned that misinformation research at the top, because people really do not have a solid understanding of what causes cancer and what probably doesn't. So there's many of things in that list that this person might be concerned about that actually they probably don't need to be. And then the third trend I wanted to mention here was a disregarding of the link between alcohol and cancer. So making a joke of the ads. And this is, something we talked about in our planning, because we knew we were making these sort of attractive alcohol industry looking ads to be cheeky, but we knew that actually it might kind of elicit some of this response. So perhaps not surprising that we saw a little bit of that. Our influencer campaign, I know I mentioned this before, we really enjoyed working with these influencers, and actually the responses we got on their posts were far more positive, probably because it's a bit of a captive audience who already, cares about what their favorite influencer is saying. But people were, really supportive and really a lot more positive on the campaign, and sort of enjoyed that these influencers had shared some of this work. I will say, I didn't mention this before, but we didn't direct the influencers exactly what to do. We asked them to use some specific hashtags, which they did. So that lower proof life is one of the ones that we asked them to use. But we did sort of leave it up to their own creative devices, because we didn't want it to be sort of another BC Cancer message that is just kind of cloaked and people could just tell it was coming straight from us. We wanted them to really put their own personal stamp on it. And so I think that's probably also why these were very positive. We did get some backlash from in the media. And so this is an article that was written. It says guest author. This person does disclose that they are a lobbyist for the wine industry. So so that's good. I guess like the conflict of interest was declared. But this article really went through a lot of those same trends that we saw in the comments on our Instagram posts, really just kind of trying to pick apart what we were saying. Talking about tone, or talking about, the puritanical killjoy type of stuff. And what I always like to say is that if we hadn't gotten this backlash, then I would have been disappointed, because it would have meant that we were not having the reach that we wanted to have. So I'm glad the alcohol industry got a little bit mad at us, and it wasn't surprising to me. And just a shout out to our colleagues at the CCSA who wrote a very great rebuttal of this in The Hill, sort of point by point taking it down. So we didn't have to at BC Cancer. We didn't have to sort of say that, because CCSA really stepped in to pull this article apart. So I want to wrap up my talk just kind of talking about some insights and recommendations that we had. So the campaign, I think, really did provide evidence that there's interest in understanding this risk and an openness to consideration of alcohol intake. And I do think that harm reduction approach was the right approach to take. We don't want to be puritanical killjoys, and alcohol does play a part in some people's cultural experiences. And so it's really just about being mindful, and any little bit that you can cut back is fantastic. And I think that's probably why the responses were, in general, fairly positive. We found that people really liked the self-assessment tools from our survey work, and also just from the amount of engagement we got on those tools. And it can be a touchy health topic, one that maybe people don't want to speak about with their primary care provider, right? So if you sort of have an online space where people can be by themselves, they can go through that self-assessment tool multiple times to see how it might impact their risk. And maybe that is a little bit more of an approachable way to talk about something that might feel very stigmatized. And we also found that the use of advocates, meaning influencers here, can support delivering messages in different ways and maybe help overcome some of that skepticism that we certainly did come up against.
Fantastic. Thank you so much, Tina. First, I want to thank both Dr. Iqbal and Cheryl for their fantastic presentations. Just sitting here over this last hour or so, I've learned quite a lot just on sort of what's going on in each of your parts of the country and the things that you're working on. It's so inspiring to hear some of the work that's being done across the country on this important topic. So just as a bit of an introduction, if we can shift to the next slide. My name is Brandon Purcell. I'm the Advocacy Manager for Prevention and Early Detection at the Canadian Cancer Society. I'm incredibly privileged to work alongside a truly national advocacy team here. We have a good number of folks who work strictly on cancer advocacy at the federal level, and we also are privileged enough to have a presence truly from coast to coast to coast of people who are just working on cancer advocacy, or in my case, on prevention and early detection. So that's causes of cancer, whether that be alcohol or radon or unhealthy foods, and early detection being any of the screening programs that are operated in our provinces. So I want to thank Kate for putting this project together. It's great to be able to speak to all of you. So what I'm going to be doing today is taking a look at what we know about alcohol and cancer risk, and discuss what the Canadian Cancer Society is doing in our advocacy to raise awareness and reduce the costs and harms of alcohol. We'll wrap up with how this relates to you and what you can do to learn more or get a bit more involved. Next slide, please. So my colleagues have touched on this a little bit, but I'll reiterate just a bit. We know that as of 2003, about 77% of Canadian adults reported consuming alcoholic beverages within the previous year. I like to keep that in mind because as I work on alcohol consumption advocacy, I remember that there's a solid quarter of the Canadian population that doesn't actually consume alcohol. And it's a bit interesting to consider the ways in which our public spaces and social gatherings can actually be made more inclusive by reducing the emphasis on drinking alcohol. Similarly, we know that about 2 out of 10 Canadian adults consume 1 or more alcoholic drinks per day. Now, despite this number seeming small, it equates to over 7 million people in Canada consuming alcohol daily. I also think it's interesting to reflect upon the role our media, and this is something that's been mentioned before in this seminar, but the role that our media and alcohol marketing play in marketing alcohol, making it seem like it's being consumed everywhere all the time, which in turn influences public behavior. Next slide, please. So alcohol isn't known to increase the risk of all types of cancer, but it is classified as a group 1 carcinogen, which means it's a cancer-causing substance, just like tobacco. Alcohol is estimated to be one of the top 3 causes of cancer deaths worldwide, and evidences indicate that regular alcohol consumption of any type, be that wine, beer, or spirits, over time, and even at low levels, increases the risk of developing at least 9 different cancers, which are shown in the image on the slide. This anatomical figure stands out for me for a couple of reasons. First, because breast and colorectal cancers remain among the most commonly diagnosed cancers in Canada as of this year. Second, cancer cases among people under 50 have been on the rise in many parts of the world. The cancers causing the most disease and death in this younger age group include breast, stomach, and colorectal cancers. And researchers suggest that tobacco, alcohol, and obesity are key factors behind this increase. Lastly, the low survival cancers that are caused by alcohol include cancers of the pancreas, esophagus, liver, stomach, and all of these are increased with alcohol consumption. And I do briefly want to just take a pause for a moment to acknowledge that about 4 in 10 cancer cases can be prevented through healthy living and policies that protect the health of people in Canada. And that's what we're talking about today. However, this means that 6 in 10 cancer cases can't be prevented, and under no circumstances should people be blamed, shamed, or stigmatized for receiving a cancer diagnosis. Our efforts in prevention are about creating healthier environments that help reduce cancer risk and preventable cancer cases. But this all begs a question. If people better understood the extent to which alcohol is a key modifiable cancer risk factor for some of the most common and increasing cancers, particularly among younger people, as well as some of the least easily treated cancers, might they be empowered to make different decisions for their health? Next slide, please. So the intensity and duration of alcohol consumption impacts different cancer types in different ways. Cancer risk increases most among those consuming 4 or more alcoholic beverages in a day. These are high-risk folks. And those consuming 1 to 4 alcoholic beverages a day, moderate risk. But even those who just consume no more than 1 alcoholic beverage a day are at low but not no risk. Next slide, please. So alarmingly, alcohol accounts for about 40% of the overall cost of substance use in Canada, which, as you can see here, is more than the cost for opioids, cannabis, and cocaine combined. Alcohol is responsible for the most productive years of life lost, alongside opioids, the most hospital stays, and the most emergency department visits. 19% of total alcohol costs are driven by healthcare cost, which includes the cost of physicians and prescription drugs. Now, with all this research, cancer-specific and general health, it becomes quickly apparent that it is collectively costing us significantly, economically and socially, to uphold our current relationship with alcohol. However, next slide, please. However, with these concerning numbers comes great opportunity. The top green line that you see here shows that if everyone who currently consumes more than 1 alcoholic drink per day reduced the number of alcoholic beverages they consume by 1, we could prevent almost 4,800 cancer cases in 2042 and prevent over 68,000 cancer cases between now and that time. Furthermore, a 25% reduction in alcohol consumption prevalence among people in Canada between now and 2032 could prevent 10,300 cancer cases and save almost $1 billion in cancer management costs. These statistics demonstrate the extent to which incremental changes in our collective behavior has the potential to have huge positive impact on our healthcare system and the health of people in Canada. Next slide, please. So again, this is something that's been touched on before, but I think it's worth reiterating. Despite there being over 30 years of research on the link between alcohol and cancer risk, public awareness remains relatively low. Data from CARIX and the Canadian Cancer Society research project shows that today over 40% of Canadians remain unaware that alcohol consumption increases the risk of cancer. This is important because we believe people in Canada have a right to clear and accessible information about the health and safety of the products they buy, so that they can make informed decisions for their health. And I'll talk a bit more on this in a moment, but I do sort of want to touch on something that Cheryl mentioned, and that's sort of on the public reaction that came from some of the work you had done and when the guidance came out last year. I came into this. I was in a different position before I came into this job at the Canadian Cancer Society, and I was very much actually one of those reactionary thinkers, thinking, "Oh, this is ridiculous. Who are these people to be telling me what I can and can't do?" And I use that frame of reference in the advocacy work that I do day to day, basically using any opportunity I have to ask myself, like, okay, how am I going to use this opportunity to communicate with myself from a year or two ago? And I try and take that mentality every day going forward. So if we can pop to the next slide. So when Canadians are asked about their support for public health measures, there is actually quite substantial support for taking action. 8 in 10 people in Canada support the implementation of warning labels or health messaging on alcohol products as a strategy to raise awareness of health risks and cancer. A further 8 in 10 support including nutrition facts and tables on alcoholic beverages, and 9 in 10 support standard drink labeling to increase awareness about standard drink sizes. So we can see that there's actually an appetite among Canadians to begin having a discussion on alcohol policy, even if we're still in an early stage of convincing the public about the link between alcohol and cancer. And we still very much are at that early stage. Every once in a while on social media, there's a picture that makes the rounds, and it's from back in the day. You had doctors passing out cigarettes in hospitals. And the way I describe where we are in our relationship to alcohol and our advocacy is we're only a few steps beyond that as far as the relationship is concerned. I'm not saying that doctors are we're going around passing out shots of tequila in the past couple of years, but in terms of sort of the public's perception and the public awareness about this issue, we're still only starting to make progress. Next slide, please. So now I'll talk a little bit more about what CCS is doing in our advocacy. So last year we launched our alcohol policy position that states our commitment to advocating for stronger policies that reduce the alcohol consumption of people in Canada and increase their awareness about the risk of cancer related to alcohol consumption. Next slide, please. So here's a couple of the key policy priorities that we're working on right now. This is by no means an exhaustive list. We have a full slate of positions at the national level, at the provincial level, and we're in the process of developing municipal policy positions as well, so that we can be advocates working on any part of this spectrum. So CCS's primary call to action at the moment was mentioned a number of times, and that's alcohol warning labels. We want the federal government to commit to implement mandatory labels, including warning with health and safety messaging on all alcoholic products sold in Canada. These labels should include standard drink information, nutrition labeling, risk for cancer and other chronic diseases, and Canada's guidance on alcohol and health. We also believe that provinces and territories have a responsibility to implement mandatory health and safety messaging requirements, including the risk for cancer and other chronic diseases related to alcohol consumption at any outlet where alcohol is sold. We have additionally been very active on the alcohol excise tax. I use the abbreviation escalator tax. I know some folks don't like that. I think, but in my opinion, it's sort of the easiest way of communicating the issue with government. And I'll talk a bit more about what we're doing on that point in a moment. But I do want to take a moment and talk about a recent advocacy campaign that we've been involved in. And we were communicating with the federal government on the recent changes to the GST and HST, since the federal government has decided to take off that tax for 2 months on alcohol. We put a call out to folks across the country, asking them to help out, to send a message to the federal government that this is the wrong course of action. It is not the message you should be sending to Canadians at any point. And there was a tremendous response, and I've seen from the attendance on this call that a number of the folks who were involved in that process are here today. So just from the bottom of my heart, I want to personally thank each and every one of you for taking part in that campaign. It was incredibly important to us and moving to me to have that kind of community support. So I just wanted to take a moment to thank you all for that. Getting back to our priorities, talking about advertising restrictions. So the federal government has taken the lead on advertising controls for tobacco for years. And is on the edge of implementing controls on marketing to kids. We want to see a review of existing advertising regulatory systems with a view to updating these standards, especially as they pertain to youth, as well as the mechanisms of receiving and responding to consumer complaints about alcohol advertising. And finally, it is absolutely crucial that the federal government, along with every province, territory, and municipality, endorse Canada's guidance on alcohol and health. And I do want to give a shout out to Manitoba, who just a couple of weeks ago made that transition. And next slide, please. So diving a bit more into our ask on warning labels, there was a first of its kind scientific study that took place in the Yukon in 2017 that was led by Aaron Hoban and Tim Stockwell from Public Health Ontario and the Canadian Institute for Substance Use Research, respectively. This project tested the effectiveness of alcohol warning labels, and despite being disrupted by lobbying efforts from the alcohol industry, successfully demonstrated that people remembered what the labels said, that they talked about the labels, and that consumers decided to drink less as both alcohol sales and consumption went down. It's because of studies like these that we know warning labels on alcohol products can help inform the public about the risks of alcohol consumption, including cancer risks, alcohol labeling, along with continued education. This will ensure that people in Canada can make informed decisions for their health. Next slide, please. More recently, a Canadian Cancer Society study, also led by Dr. Aaron Hoban, found that cancer warning labels on alcohol products appear to be associated with lower appeal, higher perceived risks, and reduced consumption intentions, even in the presence of nutrient claims from the producer, such as 0 grams of sugar. This study contributes to the body of evidence that health warning labels can effectively inform the public about alcohol consumption and cancer risk and potentially reduce alcohol consumption in the general population. Next slide, please. So going back to what I touched on a moment ago, the federal government recently, as you all know, implemented a federal holiday on the sale of alcohol as far as GST and HST are concerned. And apart from sending the wrong message about alcohol consumption and the negative health implications this will have, this will result in a widening of the gap in Canada's alcohol harms deficit. As I'd mentioned, we authored a letter that was co-signed by dozens of concerned advocates, doctors, and public health officials across the country to voice our collective opposition to this move. This letter went into government just yesterday, and we know it's already making the rounds in there. We've been hearing from our sources in government that there's conversation going on. So again, I do want to thank everyone who was involved in that effort. Now, rather concerningly, the government made this decision in the lead up to Budget 2025, where once again, we're expecting to be fighting for an increase to the alcohol excise tax, or escalator tax, as I call it, in line with inflation, as it is supposed to do every single year. But last year, the lobbyists for the alcohol industry and the convenience store industry were able to successfully convince the federal government to decrease the amount that tax went up because of the high levels of inflation. So in our conversations with government, we will be making it known that an increase in line with this year's inflation is not adequate, and that the tax actually needs to increase to where it should have been had the government not provided that relief in last year's budget. If we can step to the next slide, please. So I'll take a moment now to talk a little bit about some of the other measures, the non-advocacy related measures that we're taking to raise awareness about the links between alcohol and cancer. So we're committed to increasing awareness about this link because it's an important first step to changing attitudes and behaviors. Right now, we do this through a variety of ways, including several pages on our website, cancer.ca, the It's My Life program, which is an online interactive cancer prevention tool. We have a fundraiser called Go Dry in January that challenges people across Canada to go alcohol-free and raise funds for the Canadian Cancer Society. It's really been encouraging to us that 75% of the participants in that program said that they'll drink less alcohol after participating in that campaign. And last year, almost 15,000 people participated in that campaign. So if you're interested in joining us next month, you can find out more and register at godry.ca. And finally, I'll mention this isn't our project, but it's something that we've been talking a lot about internally, and it's something that is going to be incorporated into our Go Dry campaign this year, is the No Alcohol web app. And this is a fantastic tool that we believe is really great at complementing some of the work that we're doing in terms of taking that next step for people who are willing to make that life transition, or who are interested in making that life transition, because this tool provides a very specific output for the health benefits that you will see from just a slight decrease to your alcohol intake. It's very much a fascinating tool, and I recommend anyone take a moment to take a look at it when they have the chance. So we can move to the next slide, please. So what were some of the results of our Go Dry challenge from this year? So I'm happy to say that among those that took part in the Canadian Cancer Society's Go Dry Challenge, we saw that a full 3/4 of respondents wanted to reduce their alcohol intake going forward. And as you can see there on the right, we can see that 25% of folks became more physically active as part of the campaign, and 20% changed their diet just from taking part in this campaign. So there's a good amount going on both in terms of the advocacy arm and the public engagement arm of what we're doing. So we'll move to the next slide, please. So as I'm sure many of you have figured out right now, there are many parallels between what our society is going through with alcohol and what was experienced 50 years ago with tobacco. Tobacco was widely encouraged before its health harms were more thoroughly understood. This change has taken place over decades. Our team sees this as an exciting chance to drastically change population health for the better in matters related to cancer, but also across the 200+ other health conditions, including liver cirrhosis, cardiovascular disease, mental health, and other chronic health issues. This is a big problem that will require more than one solution tailored to many different audiences. And we're grateful for those who are open-minded and willing to explore this with us. Next slide, please. So we at CCS are committed to our role in this issue and as a champion for people living with and beyond cancer. But nothing gets solved nothing gets solved by one person or one organization. So if you're looking for more information on opportunities to take action, we would invite you to sign our next coalition letter to Minister Freeland to increase the alcohol excise tax. This is something that we're going to be doing in the lead up to Budget 2025. You can visit cancer.ca, particularly our pages on alcohol policy, limiting alcohol, and sobering facts about alcohol and cancer risk. You can join us next month as we reevaluate our relationship with alcohol, raise awareness about the link between alcohol and cancer, and promote the idea that we can modify our alcohol consumption to reduce our cancer risks. And if anybody has questions for me, or if you did want to join in on that advocacy letter that's going to Minister Freeland in the new year, I'd invite you to please reach out. My email is right there. More than happy to have to connect and chat in the future. Or if you'd just like to be added to CCS's contact list for periodic email updates about our advocacy efforts on alcohol policy, you can reach out to me there as well.